So this is our opportunity to talk about Medicare and what it is, what it isn't, what we need to be aware of, all of the phone calls that are coming this time of year. And that's because the deadline is coming up pretty quickly. I want to introduce two people to our panel, and that is Ray Walker and Sebastian Chambers. And so please, would you introduce yourself, Ray, and tell everybody what it is you do concerning Medicare for Oklahoma?
You bet. I'm Ray Walker. I'm the director for the Medicare Assistance Program at the Oklahoma Insurance Department. And we're a program that is actually funded by federal grants from the Administration for Community Living to assist people in understanding Medicare and how Medicare works and what the different parts of Medicare are, as well as other components of the Medicare system, which includes fraud, low income assistance, and things of that nature.
Fantastic. And Sebastian, would you introduce yourself, please?
Yes, my name's Sebastian Chambers. My wife and I, LaQuinta Chambers, we are local, private agents. We're for private companies. Not private companies. Private companies. So we're not affiliated with the government or anything like that, but we can assist people with getting Medicare supplement, Medicare Advantage, prescription drug plans, dental, vision, hearing plans. So we can help people get private insurance as they need to make sure they meet the requirements that the government requires that they have.
All right, thank you. And we want to start right off by talking about what is Medicare exactly? Either of you or both of you explain what Medicare is.
I can do it, Ray. It don't matter.
All right.
So, Medicare basically is a program that is pretty much is a big government account for health services for our 65 and older people with certain diseases like end-stage renal, some people with certain types of blindness and certain types of disabilities if they qualify for it. And so you have your Part A, which is your hospitalization, and your sorry about that. I got a phone call. I'm sorry. Did I get off? Sorry about that. I got interrupted by a phone call. Sorry about that. So I had so Part A is the hospitalization. Part B helps covers doctor visits. Your Part A, normally, if someone works their 40 quarters, will qualify for their Part A the Part A premium to be covered. If they also have those 40 quarters covered and they're not on any government assistance, they'll pay whatever the fee is each month, the premium for Part B. And that way they'll have both their hospitalization and doctor visits covered. And then after that, all they have to do is go in and find a private company to get Part D drug plan, and that they'll meet the requirements.
All right, then. So that was my next question, Ray. Is Medicare automatic after you get to a certain age?
Not necessarily. You have to sign up for Medicare. There's no law that says you absolutely have to take out Medicare. Now, most people that are on disability, they will automatically be signed up for Medicare. And typically when people are on Social Security, they wind up on Medicare as well. But again, if a person were to refuse Medicare, that is their right. However, if a person doesn't take out Medicare when they're originally eligible for it, there is a penalty if they later on decide that they would like to take out Medicare. So it's important for people that people consider that decision very, very carefully. We always want to make sure people have the healthcare coverage that they all are eventually going to need. As we get older, we're going to have healthcare issues. We're going to have there's going to be reasons why we're going to need that healthcare coverage. And frequently when we do talk to people who maybe have perhaps delayed taking out their Medicare, they're frustrated and they say, why in the world am I being penalized or charged a penalty because I didn't take out my Medicare? I wasn't sick. And we simply tell them, do you have car insurance because you're planning on having a car wreck?
Right.
No, you have it in case you're going to have a car wreck. So it's very important that people do look at those options, whether that's straight Medicare, Medicare Advantage, Medicare supplement insurance, all of those things, to make sure they've got the coverage that they could possibly need.
Now, where is the money coming from to pay for this? Do they pay for it out of their pocket?
As people have been going along, as you're working right now, you're paying FICA taxes. And a lot of times people look at their paycheck and say, who is this FICA person and why am I giving them money? The money that funds Social Security and Medicare, for the most part, comes out of those FICA taxes. So the majority of people don't pay for their Part A, as Sebastian stated. Now, Part B, we all pay for. For 2025, the Part B monthly premium is going to be $185 a month. So that's what people are going to pay for that Part B. Now, some people haven't worked enough quarters, as Sebastian mentioned. If you've worked less than 10 years, you may still be able to get Part A of Medicare, but you would have to pay to do that. If you've worked at least 30 quarters, you can get it for $285 a month. However, if you've worked less than 30 quarters, it would be $518 a month, which is pretty pricey.
That's pretty pricey. Good gracious. And the older you get, your income dwindles if you're not working. So how in the world is someone going to afford that?
Well, we hope that people are taking advantage of, getting enrolled when they're supposed to. Also, for those individuals who are low income, there are assistance programs out there if they meet the income and asset limits that they can qualify to get enrolled in those programs.
Okay, then. Sebastian, I'm thinking about a particular situation, someone who, because of their age or the time that they have worked in their life, it was assumed they had Medicare but did not. What can you just kind of give just a ballpark of what that was about? If you remember it.
Kind of, sort of, not really. I do know that most of the times, like Ray said, it's not an automatic enrollment. People do have to enroll. I have seen times where people were automatically enrolled, but most of the time, like if somebody takes their Social Security at 62, a lot of times I've seen those people be automatically enrolled because they're already in the system, everything's set up. They know they're aging in, they'll get notifications. And if they don't deny or waive any type of benefits, it will automatically enroll. But there's times where people aren't and they continue to work. And some people think because they still have a job, they can just keep their job insurance, which partly is true. They have the option to waive Part B sometimes, depending on the type of benefits at the job, if it's considered credible insurance. And then they take their Part A. And then once they retire, they have 60 days to enroll into their Part B. So sometimes people aren't made aware of that, and they may not enroll in their Part B, and then they'll go to retire, and all this time they didn't have credible coverage, and now they assess a late enrollment penalty that sticks on there for life. So I think that's the situation you were referring to.
Excuse me, once you have Medicare, can you be kicked off?
Only if you don't pay your premiums.
Okay.
Yeah. Yeah, I was about to say the same thing, right?
Okay, then.
Well, and a good point that Sebastian was making, we do have a large number of people who are making the choice to retire before the age of 65. So they can do that and they can start collecting their Social Security. However, Medicare doesn't start till you're 65. So it's important for people to understand and to think about, what am I going to do for insurance coverage between the ages of 62 and 65?
Right now, because the deadline is coming up, the phone calls are horrendous. They are coming back to back, back to back. And of course, it's not someone you can talk to. It's a recording that says, hello, are you there? So these phone calls that are coming, are they coming from Medicare?
No. Well, okay, so here's the deal. People are going to be getting phone calls from a variety of people across the country. Mm-hmm. And this is one of the sticks that kind of gouges me in the side every single year. Oklahoma is blessed to have a number of very competent, well-educated insurance agents right here in our own state. But unfortunately, the way it works is a person can be licensed in the state of Oklahoma, but actually calling from just any state in the country. Mm-hmm. And sometimes the story that they share isn't always 100% accurate. Sometimes they say things like they work with Medicare or they represent Medicare or something like that. And that's not accurate. That is not the truth. And they tell people things that might steer them in the wrong direction. Perhaps a person has called and they're interested in, say, a Medicare supplement policy, also called a Medigap policy. Those are the policies that actually work with traditional Medicare. And the person that they're talking to on the phone might say, oh, well, I've got a policy. I've got just exactly what you're looking for, and it will work with your Medicare and it won't cost you a thing. Mm-hmm. Now, that sounds pretty good, but what that person is actually talking about is a Medicare Advantage plan, which is perfectly acceptable, but it's not what they ask for.
Uh-huh.
So it's not exactly fraud, but it's certainly not very ethical. And I see Sebastian shaking his head because he's run into this too.
So what happened? Go ahead, Sebastian.
Yeah. Well, I was saying it's just something that happens all the time. And I mean, like Ray was saying, I'm a local agent. I'm in the community. We literally have about 1,000 clients in the community and around the surrounding counties. And what we find is so many people get these phone calls and they're being told that it's a government entity, or they say they're from such and such company, and it's just not the case. And all along, they're just trying to make a sale, not even taking into account the things that's going on in the local area. Myself being a local agent, I work very closely with the hospitals, dentist offices, you name it. These places send me people. Our local Social Security office, I get a chance to help out when people get ready to go there. I'm able to send them to Social Security to get direct questions about what they need, and not just somebody lying to them, telling them that they're going to get some kind of benefits that's not even really available to them. Mm-hmm. But that way they can go and verify what they actually have, and then we can assess what they actually need. But people calling on the phones, they can't provide that service. All they can do is enroll them in a plan, and they will get enrolled in almost 7 times out of 10 enrolled in plans that do them no good. It actually harms and interferes with what those people need to get done. Can you imagine a family member having cancer and they go to the hospital and they get told, oh, we don't take that insurance here? Mm-hmm. That's what happens when people take phone calls and don't have a true assessment of what kind of benefits that they need to have.
And so then that's my next question. What happens if they do get enrolled in a plan that does not work for them, they're stuck for the next year until the next enrollment period?
Not necessarily. There are situations where we, as the insurance department, will get phone calls from people who found themselves in that situation. They felt like they were misled by the agent that they were talking to, and there were circumstances that they had wrong information. We can actually make an appeal to the Centers for Medicare and Medicaid Services and make a case to try and get those people out of that plan that doesn't work for them, and hopefully get them moved into something that will actually provide them the coverage that they need. But there's no guarantee. It's a case-by-case basis.
Right, right.
Also, we have an open enrollment period coming from January 1st to March 31st, where people with Medicare Advantage can get switched either back to original Medicare, to just drug plans, or switching to a Medicare Advantage plan that would better fit their needs.
Okay, yes. Thank you for mentioning that, because I thought that the enrollment period was over with on December 8th. And I'm always kind of wondering, why do they keep calling after the point, or I keep seeing the commercials after that point? I'm thinking, I thought this was over with. So there is another enrollment time after the first of the year.
The enrollment time that runs from October 15th through December 7th is the Medicare open enrollment period, or annual election period. It's got several different names. Mm-hmm. And during that time period, you can select a Part D drug plan, a Medicare Advantage plan, pretty much anything you want to. You can switch between Medicare Advantage plans or Part D plans, et cetera, et cetera. The one that Sebastian is talking about, and that's pretty new. What was it, about last 2 years, 3 years, Sebastian, that we've had this?
I can't remember exactly. I've been doing this since 2019, and ever since then, from January 1st to March 31st, they call it the open enrollment period, where you have to be on Medicare Advantage. And if you're on Medicare Advantage, you can switch in between plans, drop Medicare Advantage, or switch to a drug plan only. So you do have those options. Now, people that didn't participate in AEP, or people that do not have Medicare Advantage, cannot participate in that time from January 1st to March 31st.
Yeah.
Now, what is the difference between the Medicare Advantage and Part D drug plan?
So Medicare Advantage plans are what they call Part C. They're plans that incorporate A, B, D, and sometimes other dental, vision, and hearing benefits. Okay. When you hear drug plan, it's simply a plan, Part D, that basically helps with reducing the cost for drugs and which also meets the minimum requirements for drug insurance for seniors 65 and up on Medicare.
Okay, okay then. All right, so they need all of it? A, B, C, and D?
Mm-hmm.
Yeah, you not so when it comes to C, it's not about a need, it's more of a preference when it comes to Part C.
Oh,
Now, keep in mind, if someone doesn't have Part C or a supplement plan, they're going to incur 20% of all hospitalization and doctor's visits. So if they don't at least get enrolled in Part C and or a not and or I'm sorry, Medicare Advantage or a supplement, because you can't have both at the same time. You have
okay.
to choose one. Medicare Advantage is a primary plan because it's what people call Medicare replacement. It's not really a replacement. It's more like having a private company manage your Medicare account. Supplement plans come in and cover the 20%. So there are two different ways of getting coverage. And Medicare Advantage, I share with my clients, think of it more like paying as you go because you pay co-pays throughout the year when you have visits. And Medicare Supplement is more of a prepay. You're going to pay for it whether you use it or not.
Mhm.
So depending on what type of coverage you want will determine which one you choose. Also, affordability is very key. Some
Right.
people can't afford the cost of supplement plans. So in that case, Part C is a good option, but you have to be very careful because there's things that can come up that if you're not careful, it could complicate stuff. So you need to really have someone that's educated about the plans, how they work, and what's going to be best. It's not a cookie cutter. I can't just go in as an agent and just put everybody on one plan or the other because I make the most money at it. You really have to assess needs of the clients and make sure you're choosing something because we partly have a fiduciary responsibility to do what's in the best interest of the client, especially having a life insurance license. That's somewhat of an oath that we take, not that we actually raise our hand and take it, but we do commit.
Well, and this, what Sebastian is saying is the point of going to a local insurance agent. Sebastian isn't just there representing all the insurance policies. He also knows who are the carriers who work with Comanche County Memorial Hospital and who work with the different rehab facilities down there in the Lawton area.
Mhm.
So it combines the needs of identifying what you can afford with who actually works with those providers. It does a person no good to get enrolled in a cost-effective Medicare Advantage plan if they can't see any of the local providers. If they wind up having to drive all the way to Oklahoma City just to receive medical care, it sort of defeats the purpose.
Of course, of course. Now, if you have other insurances, is Medicare kind of your last one that's used, or is Medicare the first one that's used?
It's interesting because it kind of depends on the situation. If you're still working, there are some people who are still working and they also have Medicare. And if they work for a large employer, their large employer group coverage is going to be primary and their Medicare is going to pay secondary.
Mhm.
But if it's a small employer group, then the reverse would be the case. Medicare is going to be primary and your employer group coverage would pay secondary. Now, let's say that this is a retired person. This person no longer is working, they've gone fishing. So in most cases, Medicare is going to be primary. And then we start looking at what other coverage do they have? Did they have a retiree plan through their employer? That might be the next payer. Are they eligible for Medicaid? Medicaid might be the next payer.
What's the difference
Indian
between
Health
Medicaid
Services
and
coverage.
Medicare?
Do what?
What's the difference between Medicaid and Medicare?
Okay, Medicare is the health insurance that was specifically created by the Social Security Act for people who are 65 and over. It's also for people who are on disability, and they have to have been on disability for 24 months before they qualify. It's also available for people who have Lou Gehrig's disease or who have end-stage renal disease. Medicaid is low-income assistance for people of any age. That is available, and it's more of a shared program between the state and the federal government. Medicare is 100% federal.
Okay, then. So they might have Medicaid and Medicare, but it's not necessarily so. Then they can use all of the insurances they have when they go to a doctor.
That is correct. Now, to the point that Sebastian was making, let's say that you did get enrolled in a Medicare Advantage plan. That's one of those Part C plans. It's kind of a substitute. If that's the case, then, and let's say that you had a Medicare supplement policy or you had a retiree plan, your Advantage plan isn't going to coordinate with those other coverages. It basically kind of takes over. So oftentimes what we do and what agents like Sebastian are doing is we try to make sure that people aren't overinsured. Some people, out of fear, they may have multiple insurance policies, and it turns out they're spending money that they don't really need to spend. So we try to make sure that they've got what they need for when they need it, and that they're not spending money needlessly.
Okay. When these phone calls come in, I thought there was a do not call list, and it doesn't seem to be working. And I block numbers, and they call again, and they call again, and you never get to tell them, I don't need your service.
Right.
So is there any recourse for people with all these hundreds of calls coming daily, and the closer we get to deadline, I assume they're going to increase?
Yeah, I love that you mentioned the do not call list, because that's the important thing to point out. The people that are calling you, they don't care about the do not call list. Yes, there is a do not call list, and by all means, get on that list. But you can be assured that if somebody's calling you, that they don't care about that sort of thing. So we tell people, if you don't recognize the phone number that is on your caller ID, don't answer the telephone. If it's important, they'll leave a message, and you can call them back if you need to.
Right.
Don't even push the button. You know how you can push that button to make the ringing stop? We tell people, don't even do that. With today's technology, that's telling a computer system, oop, somebody was there to push that button. So we tell them, just let the darn thing ring and let it go to voicemail. And then that way, they don't know whether somebody was there or not. Again, they'll leave a message. If it is important, they'll call you back. Earlier, you made the question about, does Medicare call you? Medicare and Social Security are not going to call you. All right. They're going to communicate with you through the mail. Now, Medicare and Social Security both have started using emails and online communications more, but they only do it with your permission. You will know if you've signed up for those services.
Right.
But they're not going to give you a phone call. And in the off chance that one of those agencies did give you a call, they would never, ever, ever ask you for your Medicare number or your Social Security number. They've already got it. So we tell people those are clues. Those are signs that this is not somebody that needs that information. If they call and they say that they're contacting you about getting a new laminated Medicare card, don't believe it. That's not going to happen. You would find out about that information through the mail. You'd hear about it on the news. There would be other indicators.
Right. And Sebastian, likewise, local reputable agencies such as yours, you're not going to cold call people, are you?
We're not allowed to, according to CMS rules. If a person doesn't initiate contact with us, then we're not allowed to call. Another thing is we literally have to get permission and have a certain form signed before we can even call to make contact, to even schedule an appointment. So if an agent calls and says, hey, we see that you're 65 and you're probably on Medicare, blah, 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 you might as well hang up the phone, because they've already broken the rules, because you're not supposed to call anyone and solicit to anyone that you may think is on Medicare.
Right. Well,
They
that's
can't
good.
show up at your house either.
They can't show up at the house either.
Do they show up at the house?
Oh, yes.
Oh my gosh, that's blatant. Wow. All right. I had no
Yeah.
idea. I'm not having
They'll go
anybody
to
show
door.
up.
If there's an apartment complex that's known to be a senior living facility, they'll go to door.
Oh,
And I'll say this too. I've noticed that happens with new agents that don't really understand the rules. So it's not. I wouldn't want people to think that the folks that are doing that are always trying to be malicious or trying to be dishonest. They're just excited salesmen out there trying to make a living and pay their bills to take care of their families. But it's very important that everyone abides by the rules that have been set, because really it's to help protect our seniors and to make sure that the integrity of the system works the way it's supposed to, getting people placed in the right types of plans so people can get the right type of benefits so that so the system can work the way it was designed,
Yes.
yeah. I had a friend who thought she had Medicare. I don't know what happened. I really don't. But somewhere along the way, she found she didn't have it. And stuff. And so she, of course, we both kind of freaked out. I was like, I don't know, I've never heard this before, and stuff. So whatever her situation was, but so it's something that we really should just be more proactive in our own lives to understand what it is and what we need it for and what we don't need it for, and to make sure we have exactly the amount that we need, as you said, not over insure. But the biggest thing that we really want people to know is don't answer that phone.
Correct. Yes. Be
Hey,
very,
I
very
do. I'm
cautious
sorry.
about what you're responding to, whether that's on the phone, whether that's online. Internet has become a huge problem in terms of getting people to click on things that they shouldn't. If you're wanting to talk to somebody about your insurance, the people you need to talk about is a licensed agent in the state of Oklahoma. And if you're not sure somebody's licensed, call the Oklahoma Insurance Department. We can let you know. And also talking to your physician about what insurance they accept. Talk to them about what they would suggest would be a good fit for you as well. Sometimes they've got some good information.
Oh, wonderful. Sebastian, you were going to say?
I do need to go. My time is up. But feel free to please reach out to me. And Ray, I would like to connect to help get some more information to help make sure that we're running smooth and efficiently in our community. So, but thank you, Tara, for having me on.
I like everything that Sebastian said about the licensure and the local agent and all of that stuff. Yet you've made me feel during this open enrollment so much calmer today after the week that we've had. So thank you, Sebastian.
Oh my God. I still got to fight through Saturday, Ray. I've been fighting like a warrior, trying to protect my community. It's crazy.
Well, thank you both so much for being with us today. And we do appreciate it. And again, we look forward to talking to you again, maybe in the next open enrollment. So thank you very much.
All right.
Thanks.
Thank you.
Bye-bye.
All right.